So doctor, when a patient's considering a breast augmentation, I think one of the first questions that might go through their mind is, what are the complications after a breast augmentation? So can you share what those might be and how you would treat them?
Very good question. I mean, we always we have to look in future. What's the consequences of any action? I would categorize all the complications after breast augmentation as a early onset or late onset possible complications. Some of the problems or complication could happen right away after surgery. Those could be like the bleeding or hematoma. The chance of that is less than 1%. If that happens, the surgeon should get the patient back to the OR and depends of the hematoma and get that implant out, wash the cavity, and most of the time the surgeon is able to put the implant back in place at the same session. The other possible complication is infection. When infection happens after breast augmentation, because it's in a setup of the foreign body, I call the implant as a foreign body, and the most of the cases it's difficult to treat the infection completely without taking the implant out. So should consider at some point to get the implant out to complete the treatment of the infection that happens right after surgery. It's very common practice that the patient will receive antibiotic right before surgery, and the patient stays on oral antibiotic after surgery. All of this is for minimizing the chance of the infection. However, always there is a chance. Fortunately, the chances of the bleeding and infection is very low after the plastic surgeries in general, and specifically in breast augmentation. Other possible complication could happen, I would say, the late onset possible complications that happens later on during the healing process could be a pocket malposition. That means the implant is not sitting in the place that we want it exactly. Or that could be capsular contracture. That means a process that's going to cause the breast become hard or at some point become deformed. So they should be treated in their own case. You have to find out what was the causing factor of that. If we can reverse that, we have to reverse that or use some tools to prevent that happening again.